Welcome back to Blood Sugar Squad, your go-to channel for simple, actionable tips to manage diabetes and live your best life. If you're managing type 2 diabetes, you've likely heard a whirlwind of information about medications. Names like metformin, Ozempic, and today's topic, Jardiance, get thrown around. It can be overwhelming, even confusing. Is it just another pill? What makes it different? And most importantly, could it be right for you? Today, we're pulling back the curtain on one of the most talked about drugs in the diabetes world. This is the unvarnished truth about Jardiance, the remarkable benefits, the not-so-fun side effects, including that infamous middle-of-the-night trip to the bathroom, and the key questions you need to discuss with your doctor. Remember, this video is for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Now, let's get into it. Part 1. The benefits of Jardiance. More than just sugar control. So, what exactly is Jardiance? Its generic name is Empagliflozin, and it belongs to a class of drugs called SGLT2 inhibitors. That's a mouthful, so let's break down what that actually means in a way that makes sense. Imagine your kidneys are like a sophisticated recycling plant for your blood. They filter out waste, but they're also programmed to reabsorb almost all the sugar, or glucose, back into your bloodstream. For someone without diabetes, this is a brilliant system. But for those of us with type 2 diabetes, it means a lot of excess sugar gets sent right back into our system, contributing to those high blood sugar readings. Jardiance works by essentially putting a temporary block on the main sugar reabsorption gate in your kidneys, called the SGLT2 transporter. It allows your kidneys to stop holding on to so much sugar and instead excrete the excess directly out of your body through your urine. You're quite literally peeing out the extra sugar. It's a brilliantly simple and unique mechanism of action. But the benefits go far beyond just lowering your A1C. This is where Jardiance really stands out. First, there's weight loss. Because you're excreting sugar, you're also excreting the calories that come with that sugar. Many people experience modest but consistent weight loss while on Jardiance, which itself is a huge benefit for managing type 2 diabetes. Second, and this is a massive one, cardiovascular protection. Major clinical trials have shown that Jardiance can significantly reduce the risk of major cardiovascular events like heart attack and stroke in people with type 2 diabetes who also have established heart disease. This was a game changer in the diabetes community, proving that a diabetes drug could do more than just lower blood sugar. It could actually save lives. Third, there's kidney protection. Similarly, studies have demonstrated that Jardiance can slow the progression of kidney disease in people with type 2 diabetes. It reduces the strain on those delicate filtering units, helping to preserve kidney function over the long term. And fourth, it may help lower blood pressure. By excreting more sugar, you also excrete more sodium and water, which can lead to a mild reduction in blood pressure, a common co-condition with diabetes. So, to recap, Jardiance isn't just a sugar-lowering pill. It's a multi-talented medication that can help with weight, protect your heart and kidneys, and lower blood pressure. It sounds almost too good to be true, right? Well, that leads us to the crucial next part of the story. Part 2. The side effects, the not-so-sweet truth. Every powerful medication comes with potential side effects, and Jardiance is no exception. Being informed is your first line of defense, so let's walk through them, starting with the most common ones. The number one side effect is directly tied to its mechanism of action. If you're excreting more sugar in your urine, you are also excreting more water. This means your body is constantly trying to flush itself out. Therefore, the most common side effects are related to the urinary and genital systems. You will likely experience increased urination. This isn't just a minor inconvenience. For many, this means getting up multiple times in the middle of the night to use the bathroom, which can seriously disrupt sleep. It also means planning your day around, knowing where the nearest restroom is. This is a very real and very common adjustment. Because you're creating a sugar-rich environment in your urine, you are at a significantly higher risk for fungal infections. For women, this means yeast infections. For men, it can mean yeast infections on the penis, a condition known as balanitis. These can be uncomfortable and require treatment. Maintaining meticulous hygiene is absolutely crucial on this medication. Following the logic of fluid loss, dehydration is a real risk. This can lead to dizziness, lightheadedness, weakness, and especially a feeling of being faint when you stand up too quickly, known as orthostatic hypotension. This is why it is absolutely critical to drink plenty of water throughout the day while taking Jardiance. This is non-negotiable. Now let's talk about two rare but very serious side effects you must be aware of. First, diabetic ketoacidosis, DKA. This is a dangerous condition where your blood becomes too acidic. It's typically associated with very high blood sugars and a severe lack of insulin, often in type 1 diabetes. However, SGLT2 inhibitors like Jardiance have been linked to cases of DKA even when blood sugar levels are not extremely high, a state called euglycemic DKA. Symptoms include nausea, vomiting, abdominal pain, extreme tiredness, and shortness of breath. This is a medical emergency. The risk is higher if you are sick, dehydrated, skipping meals, or on a very low-carb diet. Second, there is a risk of serious urinary tract infections, UTIs, that could potentially lead to a severe kidney infection or even a life-threatening bloodstream infection called sepsis. Symptoms of a UTI include a burning feeling when you urinate, pain in your lower abdomen, and a fever. If you have a fever and back pain, this could signal a kidney infection, and you need to see a doctor immediately. A less common but notable risk is lower limb amputation. Some large studies observed a small but increased risk of amputations, primarily of the toe or foot. The exact reason isn't fully understood, but it underscores the importance of daily foot checks if you're on this medication. Look for any sores, ulcers, blisters, or changes in color. Knowing all of this, how do you and your doctor decide if the benefits outweigh these risks? Part 3. Is Jardiance right for you? So, after all that, the million-dollar question remains. Is Jardiance a good fit for your diabetes management plan? This is not a decision you can make by watching a YouTube video. This is a decision for you and your doctor. But you can, and should, go into that conversation armed with the right questions and self-knowledge. Here are key factors you and your doctor will consider. Your overall health profile. Do you have established heart disease? Are you showing early signs of kidney disease? If the answer is yes, the powerful cardiovascular and renal benefits of Jardiance may make it a top-tier choice for you, potentially outweighing the side effect risks. Your personal risk factors. Do you have a history of recurrent yeast infections or UTIs? If so, Jardiance might exacerbate that problem, and you'll need to be hypervigilant about hygiene and hydration. Your lifestyle. Are you able to maintain consistent fluid intake throughout the day? Can you manage the frequent need to urinate, especially in your work or social life? Being honest about this is key to adherence and quality of life. Other medications. Jardiance is rarely the first medication prescribed. It's often added to a regimen that already includes metformin. It can also be used with other classes of drugs. Your doctor will ensure there are no dangerous interactions. The goal of this conversation is to create a personalized treatment plan. Your diabetes is as unique as you are. What works well for your friend or a person in a study might not be the perfect fit for you, and that's okay. If you and your doctor decide to move forward with Jardiance, remember these golden rules. Hydrate, hydrate, hydrate. Drink water consistently all day. Practice meticulous hygiene. This is your best defense against genital infections. Listen to your body. Report any signs of DKA such as nausea, vomiting, and fatigue. Signs of UTIs like pain and fever, and foot sores to your doctor immediately. Be patient. It takes time for your body to adjust to any new medication. We hope this deep dive into Jardiance has given you a clearer, more balanced view. It's a powerful medication with some truly impressive benefits and some very real side effects that need to be respected. Have you taken Jardiance? Please comment about your experience to help someone else who might be considering it. Until next time, stay strong, stay sweet, but not too sweet, and keep thriving with the Blood Sugar Squad.